Hi, my name is Colton Miles, and I'm a student here at South College Physical Therapy Program. Today we are seeing Brenda, who has redness, swelling, and inflammation around her knee after hitting her knee on a coffee table. She's been ruled out for fracture, so we know that we're just addressing the inflammation today.
All right.
And we are going to be using a non-thermal ultrasound to do so, to promote healing and help out with the inflammation. And I'm going to sanitize my hands and introduce myself to the patient.
Aspect of her right knee, which is just distal to the patella. She hit her knee on the edge of the coffee table 48 hours ago.
Hi Brenda, how are you?
Good, how are you?
Doing well. My name is Colton Miles, and I'm a student at the College of Physical Therapy at South College. And so, tell me a little bit about what happened. Did you run into the end of the table? Okay. And it looks like we have some swelling here, so that is what we are going to address today. And today we'll be using a non-thermal ultrasound to promote tissue healing and also to help with your pain. And the indications why we're doing this is the pain control and patellar tendon healing. And we're going to be using no heat today because of that inflammation that you have. The contraindications on your patient history form, I concluded that you did not have any recent tumors, you are not pregnant, and we will be avoiding the central nervous system tissue today. We'll be focusing on the knee. And there's no joint cement or plastic components in your knee, correct? Okay. And pacemaker, cardiac device, anything like that? Right. And have you been checked recently for blood clots?
Yeah, I don't have any.
Okay. And we're not going to be in the eye area or the carotid sinus area, so this would be a good treatment for us. Okay, so today I will be applying gel to the ultrasound head, and that emits sound waves that will travel through the skin and promote tissue healing. And this can also help with your pain. And again, we're not using heat today. Alright, and then what you should feel from this treatment is just the head moving around. No heat, just the head moving around. And so for our pretest, we are going to focus on your pain level. So before the treatment, we're going to assess your pain level, and then we're going to do the treatment. After, I'm going to ask you if your pain got any better. And that's what our main test will be today. Alright, so then for our patient position, you can go ahead and lay flat.
Alright, 3, 2. Miss Betty, how are you today?
And I'm going to place a pillow on you. And is this a comfortable position for you? Okay, if you need to alter anything, just let me know before we start the treatment. Alright, if you'll come here. Today we'll be doing non-thermal ultrasound.
So we're definitely going to work on that. So we're going to use a setting called Tensa. Basically, it's kind of like your skin.
And our frequency will be 3 hertz because it is a shallow tissue. It's pretty superficial, so we will not be going deep today. And we'll be doing a 20% duty cycle, which deals with the heat, and we don't want thermal effects today. And then we will be doing about 0.5 watts per centimeter squared. And I'm going to set the treatment time for 7 minutes, and it's usually between 5 and 10 minutes.
And I would also get some subjective feedback from the patient on her pain and weight bearing and during range of motion.
Alright.
So,
Brenda, you will feel, is it okay if we do, is this a good treatment for you, ultrasound on your knee?
Yes.
Okay. If you would like to pull your shorts up just a little bit, so I don't get the gel on you. And before we get started, I'm also going to cover this pillow so we do not get gel on it.
Okay.
Perfect. Do you have any questions? So we will go ahead and get started. So I'm going to go ahead and turn on my ultrasound machine.
So the location is just below your patella, so I will be applying gel to the sound head and to your knee, if that's okay.
Just let me know. Okay. Any questions about anything though so far?
So now that my machine is on,
You
I
ready?
am going to choose ultrasound.
Alright.
I'm gonna choose my duty cycle at 20% for non-thermal effects, which means that we only want optional effects.
And
Our
the machine is not on yet. I will be spreading around the gel right now,
because we are working with superficial
preparing for the treatment.
tissue, and we don't really need to penetrate any deeper than 1 to 2 centimeters. Our
Is this
treatment will
comfortable for
last
you?
about 5 to 10 minutes. That's really just to get
Let me know at any
the
time if it
side
becomes too uncomfortable.
and our desired
Alright,
effects.
and now I'll be turning the machine on.
What I'm going to do first when starting this treatment is put the gel on the sound head first. Make contact
And like
with
I
the skin,
said, it's at
and then turn
0.5
up the intensity because I don't want to
intensity.
damage the crystals in the sound head.
And this is a non-thermal, so just make sure you don't feel any heat, and let me know if it becomes too
So
uncomfortable.
I'm gonna go ahead and get started here. I have this gel.
And since this is a tendon region, we are going to be going over and back, not just in circles, to make sure that the sound head is kept on the area at all times.
Also, this video is recorded.
And like I said, we'll be going for about 5 to 10 minutes. For the purpose of this video, I will stop the treatment now.
And no allergies.
Turn off the machine. And I will be cleaning the sound head.
What's your favorite ice cream?
Vanilla.
Oh,
So for this here, my pulse ratio is going to set about 8.
that gentle cold there.
And then the frequency.
And I'll also be cleaning the
About,
That sound.
gel off the
I should not
patient.
be feeling anything else.
with this being the first
Now
time,
that I have
this
contact
Betty Tuesday, we're going to set for
I
15 minutes
will
just
go
to see how
ahead
she
and
does with it.
slowly turn up my
As well as we're gonna
intensity
put on
until
hold.
I get to.
Alright. So Ms. Betty, I'm going to start this here.
Okay. And
Alright.
then I can.
And then after the treatment, we'll be looking at the skin for any redness or adverse reactions that occurred. A normal response for this would be almost to see nothing. If anything, a little bit decreased inflammation. Since we did not use heat, there shouldn't be redness other than maybe moving the head around a little bit. And an abnormal response would be excessive redness or pain for the patient. And like I said, our post-test will be subjective pain. So I would ask the patient if they have any less pain than when we started the treatment. And then, Brenda, if you have any adverse reactions when you get home, give the clinic a call and we will adjust your parameters for next time or consider doing another treatment option for you. Alright. That's all I have for you today. My name is Colton Miles. I am a student of the South College Physical Therapy Program. Today we have Betty. She has right shoulder pain. She has pain when she's doing isometric contractions following her 6-week fracture of her humerus. So today we'll be using conventional TENS below the motor threshold just for symptom modulation. Alright, I'm going to introduce myself to Betty and wash my hands.
Cardiac disease, cancer, molecular tumor. Pregnancy is not a concern here, which can be in a male. And then also, no allergies to adhesives. Upon initial evaluation, there are no impairments.
Hi, Betty.
How's it going?
Good. My name is Colton Miles. I am a student of the South College Physical Therapy Program. And today we will be using a modality to help treat your anterior lateral shoulder pain. Alright. So today we'll be using pain modulation below the motor threshold. So we will not be activating contractions today, just using sensory information to help relieve your pain. We're doing this for pain control and functional movement, since you have pain when you are doing isometric contractions, you said, and hopefully will decrease your discomfort. And contraindications, do you have a cardiac pacemaker? Okay. Have you been checked for venous clots? Okay, no clotting. And then, are you pregnant or planning to be? Okay. And we'll not be going over the carotid sinus area today, so that won't be an issue. Alright. So our treatment today is TENS conventional. So I'll be placing the electrodes over your shoulder, and we'll be running a current through them to help relieve that pain. And the settings we're at, like I told you, will not be motor, they'll just be sensory. So you should not be actively contracting or moving during this treatment. Alright, and then you should feel a strong but comfortable sensation. If it's too high, I can
Initial application,
change the settings to make it more comfortable for you. We don't have to stay at the preset settings. And
I think it was still hitting that. It felt pretty good.
good. All right. So before we start the treatment, do you have any questions for me? Okay. So for this treatment, we're gonna have you sit in the chair here, and I'm gonna set up some more pillows to make you comfortable.
So in this situation, what I did,
So one will be behind your back here.
we need to, what we do is make adjustments of increasing the frequency, decreasing the intensity
And
first,
then one is going to be here to keep her arm elevated.
then we'll
And
elevate the
then,
intensity again to have.
Betty, do you mind pulling up your sleeve so I can get to the treatment area? All right.
Alright, so there you go, once you fill it on, pull it back, we're gonna hold it.
And then I have permission to use this modality,
Not bad,
correct?
right?
Yeah.
Totally fine. So with this being the first time, we're just gonna do it roughly for about 10 minutes, just try to get 10 good reps in and see how,
So I'll be placing it across your treatment area so we make sure that
so, post 10 minutes.
you're getting that pain relief in the area
10
that you
reps, we're gonna turn down that intensity.
I do feel like I should record the intro.
Alright,
All right.
so here, take
So
off the
before I
pads,
turn the
check
machine
skin,
on,
make sure no
I'm
adverse
going
effects,
to
skin is intact.
discuss the parameters with you. Today we are going to be below the motor threshold, so we're going to be between 50 and 80 for the pulse width. And then the pulse rate will be between 100 and 150 hertz. And once I turn up the amplitude, you should just let me know when you feel a strong tingle, when you feel tingling at all, and then we'll get it up to a comfortable level without it being too hot.
We can increase the reps, the intensity, or we need to back
So
off.
I'm going to get it started here.
So at this point with the post-test measurements, would not necessarily be appropriate with muscle testing.
Feel it tingling?
observing
Okay.
escape.
We are going to increase just a little bit so we can make sure we get that pain relief for you.
False
So
negative.
just let me know when it's strong but comfortable.
Alright, Jack, any questions for me?
Okay.
You did great, we'll follow
Alright.
next time,
So then the
alright?
treatment time for this would be 20 minutes. This is our first treatment, so we want to make sure that in the documentation that it's comfortable for her and that we should continue doing it on following treatments. And then this treatment can be used for any amount of time. So if she purchased one of these units, then she could use it at home whenever she's doing this. But for the clinic's sake, we'll be doing 20 minutes. All right. So then a normal response for this, we might get a little bit of redness underneath the electrodes, but it should not be too much.
I know, that was.
And we should
Usually,
also
like, sort of
see
looking like
decreased pain. She mentioned that your isometric contractions were painful. So our goal today was to decrease that isometric contraction pain. So that would be our post-test for today.
so loud.
You're like, hi, I'm Ben Burke. I'm
All right. So just let me know if you have any adverse reactions when you get home, if you have any allergic reactions or anything, and we can adjust our treatment for the next time.
Okay,
All right.
sounds good.